Short stature, height that is more than 2 standard deviation below the mean for age, sex and the population, lesser than third percentile. For the classification, proportional short stature. This is the normal upper to the lower segment ratio. Disproportionate short stature. This is abnormal upper to the lower segment ratio. Example, skeletal dysplasia. For the etiology, non-pathological causes like familial short stature, constitutional growth delay. For the pathological causes, endocrine, growth hormone deficiency, hypothyroidism, Cushing syndrome and the Turner syndrome. For the chronic systemic disorders, malnutrition, chronic kidney disease and the congenital heart disease. Genetic syndromes like the Down syndrome, Noonan syndrome. Skeletal dysplasia like achondroplasia and the rickets. For the clinical features, the familial short stature. They have the normal growth velocity, puberty and bone age match the chronical age. For the constitutional growth delay, they have delayed bone age, late puberty with the eventual catch-up growth. For the pathological causes, poor growth velocity, dysmorphic features like syndromes, delayed puberty or the hormonal imbalances, signs of the chronic illness. For the evaluation, detailed history like family height pattern, growth chart evaluation, symptoms of the systemic or the endocrine diseases. For the physical exam, growth velocity, upper to the lower segment of the ratio and the arm span, dysmorphic features. Investigations like bone age, X-ray of left hand and the wrist. Hormonic assays, IGF-1, TSH, free T4, cortisol. Genetic testing for the Turner syndrome, karyotyping. Nutritional and the systemic evaluation like CBC, ESR, renal and the liver function test. For the management, reassurance and the monitoring. For the familial short stature and the CGD. Medical therapy like growth hormone replacement, example GH deficiency and the Turner syndrome. Thyroid hormone replacement, hypothyroidism. Nutritional and the chronic disease management. Surgical intervention for the certain skeletal dysplasia. Psychological support and the counseling. Short stature, this is defined as the height lesser than third percentile or greater than 2 st below the mean for age and sex. Familial short stature and the constitutional growth delay are the common non-pathological causes. Growth velocity is key in distinguishing the pathological from non-pathological causes. Pathological causes include the endocrine disorders, GH deficiency, hypothyroidism, symptoms like Turner, Noonan and the chronic illness. Bone age assessment via the X-ray helps to differentiate familial short stature with normal bone age from the CGD delayed bone age. Hormonal evaluation includes IGF-1, TSH and the cortisol levels. Genetic testing, example karyotype for the Turner syndrome, is essential for the syndromic features. Growth hormone is indicated in the GH deficiency, Turner syndrome and the Noonan syndrome. Management of the short stature requires the addressing the underlying cause and providing the psychological support.